Why do older adults so often suffer from joint pain? It's something every second person experiences, and many feel it's just an unavoidable part of getting older. But is that really true? Today, we'll explore what actually causes joint pain and how to manage it. You might be surprised by how much you can do to improve your quality of life. As we age, our bodies change. We start to notice a loss of flexibility, and our joints become less mobile. But this isn't just about age. Several factors play a big role in causing pain. Let's look at what's really happening inside our joints. When we talk about joint pain in older people, the first thing to mention is cartilage. Cartilage is a tissue that covers the ends of bones in joints and acts like a shock absorber, cushioning impacts and preventing friction. It allows us to move comfortably and without pain. But here's the problem. With age, cartilage starts to lose its elasticity and gradually wears down. This process is called osteoarthritis, and it's one of the most common reasons for joint pain. Essentially, worn-down cartilage can't do its job as well as it used to. When cartilage thins or completely wears away, bones can start rubbing directly against each other, causing inflammation, pain, and limited movement. Imagine your joints are like an old car. The more miles it drives, the more the parts wear out. If you don't pay attention to this in time, you could face a breakdown that needs major repairs. How can you notice this happening? For instance, a simple bend or climbing stairs might start feeling uncomfortable. And if you don't take action, the pain can just get worse and your joints will lose mobility. What can you do about it? It's important to manage your weight, avoid putting excessive stress on your joints, and strengthen the muscles that support them through moderate physical activity. Stretching and strengthening exercises like yoga or swimming can help slow down the wear and tear process. There are also supplements containing chondroitin and glucosamine, which can support joint and cartilage health. So cartilage wear is a natural part of aging, but it can be slowed down and managed with the right joint care and an active lifestyle. When it comes to joint pain, we can't avoid talking about arthritis. This is a disease where joints become inflamed, and it's often the cause of chronic pain in older adults. However, it's crucial to understand that arthritis isn't necessarily just a disease of the elderly. It can have various causes and affect people of any age, although the risk certainly increases with age. The most common type of arthritis is osteoarthritis, which is exactly what we discussed earlier, where cartilage wears down and bones rub together. But there are other types, such as inflammatory arthritis, like rheumatoid arthritis. This is an autoimmune disease where the immune system mistakenly attacks its own joints, leading to inflammation and damage. Here's an interesting point. Arthritis doesn't always mean pain in just one spot. Depending on the type, inflammation can affect multiple joints at once. For example, rheumatoid arthritis often affects not just the knees or elbows, but also the small joints in the fingers, causing discomfort with movement and even at rest. Outwardly, this can look like swollen, red, or warm joints, and the pain can be severe, especially in the morning after sleeping. Often, people with arthritis have reduced mobility, making everyday tasks like getting out of a chair or climbing stairs a real struggle. What should you do about it? It's important to start treatment early. This usually involves anti-inflammatory medications to help relieve pain and inflammation, physical therapy and specific exercises to improve joint flexibility might also be recommended. Supplements that support joint health can also be beneficial. In summary, arthritis is a serious condition that needs attention. If left untreated, it can lead to loss of mobility and a reduced quality of life over time. So, at the first signs, it's best to see a doctor and not delay treatment. Another significant reason for joint pain in older adults is excess weight. When joints are subjected to excessive load, they experience additional stress, which speeds up cartilage wear and can cause inflammation. This is especially true for leg joints like the knees and hips, which bear a large portion of the load when walking. Let's explain a bit more. Every extra pound adds load to your joints. For instance, when walking or climbing stairs, your body puts pressure on your joints, and the more you weigh, the greater the load. You could compare it to carrying a heavy backpack every day. After a while, your body will start sending signals that this load is too much for it. Excess weight can also contribute to the development of osteoarthritis because fat tissue produces substances that can increase inflammation throughout the body. So it's not just the mechanical load from extra pounds that negatively affects joints, but also chemical processes happening internally. How can this be addressed? Firstly, managing your weight is crucial. A balanced diet that includes more vegetables, fruits and protein, while limiting foods high in fat and sugar, will help reduce stress on your joints. Secondly, regular physical activity like swimming, walking or yoga not only helps burn calories, but also strengthens the muscles that support the joints. Of course, losing weight isn't an instant fix. It's a process that requires time and effort. But if you shed those extra pounds, your joints will thank you. Less pain, more mobility, and your quality of life will improve significantly. The next reason for joint pain is a lack of physical activity. As we get older, many people start avoiding exercise thinking it's too hard or not needed anymore. However, the absence of movement can actually become one of the main causes of joint pain in older individuals. Why does this happen? When we don't move, our joints become less mobile. The cartilage that acts as a cushion between bones doesn't receive enough nourishment and starts to wear down. Additionally, the muscles supporting the joints weaken. All of this leads to pain and restricted movement. An example, if you sit in one place for a long time, even a simple bend or attempt to stand up might cause discomfort. Your muscles and joints aren't used to the strain and immediately start protesting. The same thing happens with your joints. They lose flexibility, become stiff, and ache. What can be done about this? The answer is simple: move. You don't have to start running marathons right away. Even simple stretching or daily walks outdoors can greatly benefit your joints. Excellent exercises for joints include swimming and yoga, which don't stress the joints but are great for developing flexibility and strengthening muscles. Strength training using your own body weight can also be helpful, but the key is moderation and not overdoing it. Small steps like a daily 20-30-minute walk can work wonders, and most importantly, regular physical activity slows down joint aging and helps prevent chronic pain. Another significant reason for joint pain in older adults is poor or insufficient nutrition. What we eat directly impacts joint health. A lack of essential vitamins and minerals like calcium, vitamin D, omega-3, fatty acids and antioxidants can lead to weakened bones and cartilage, causing pain and limiting mobility. For instance, calcium and vitamin D play a key role in maintaining bone health. Calcium helps strengthen bone tissue, and vitamin D helps the body absorb it. Without these elements, bones become more fragile, and joints start to suffer. Another important factor is omega-3 fatty acids. They have an anti-inflammatory effect and can help reduce inflammation in joints, which is especially helpful for arthritis. Fish, flaxseed oil, and nuts are excellent sources of these beneficial nutrients. But what happens if your diet is lacking these elements? Your joints start to cry, your muscles weaken, and inflammation increases. This results in pain, especially in colder weather when joints are more prone to inflammation. How can this be fixed? It's very important to eat a balanced diet. Include more foods rich in calcium, dairy products, leafy greens, nuts, and vitamin D, fatty fish, eggs, mushrooms. You can get omega-3 fatty acids from fish, especially salmon and mackerel, nuts and seeds. If this isn't always possible, consider supplements. Also, limit your intake of foods that can contribute to inflammation, such as processed foods, sugar, and refined carbohydrates. A balanced diet definitely promotes better joint health and helps you move without pain. When discussing joint pain in older adults, hormonal changes cannot be overlooked. With age, the levels of some hormones in the body change significantly, and this can affect the state of the joints. This is especially true for women, whose estrogen levels drop sharply during menopause, directly linked to the deterioration of bones and joints. Estrogen plays an important role in maintaining bone density. When its level drops, bones become more fragile, and joints experience additional stress. Women who have gone through menopause often experience accelerated bone mass loss, which can lead to osteoporosis, a condition where bones become brittle and joints more vulnerable. Men also undergo hormonal changes, although less drastic. As they age, their testosterone levels decrease, which can impact bone and joint health, though this process usually happens more slowly. Nevertheless, for both men and women, maintaining hormonal balance is important to prevent joint problems. What can be done about this? First, it's important to monitor hormone levels and consult a doctor if necessary. In some cases, hormone therapy might be needed to help balance estrogen or testosterone levels. Second, strengthening bones through proper nutrition, physical exercise, and supplements like calcium and vitamin D helps reduce the impact of hormonal changes on joints, including weight-bearing exercises like walking, light strength training, or dancing also helps strengthen bones and joints. Even if hormonal changes have already occurred, hormones play a vital role in our bodies, and their influence on joints should be considered when maintaining health. It's best not to ignore changes happening in the body and to consult a doctor in a timely manner to prevent complications. Well, here's the twist. It turns out that joint pain isn't just a result of aging, but also a matter of lifestyle, diet, and even hormonal changes. The good news is that many of these factors can be controlled. For example, proper nutrition, moderate physical activity, and weight management can significantly improve the situation. So, what have we learned? Painful joints in older age are not a sentence. There are many ways to improve joint health and even eliminate pain. The main thing is not to sit idly by and take care of your health. Share in the comments what helps you manage joint pain, and don't forget to subscribe so you don't miss out on new helpful tips.